My name is Nicole Cope, and I am the Executive Director for the Missouri Immunization Coalition. So I'd like to open the conference just to talk to you a little bit about our theme this year. Our theme is Vaccines, the Building Blocks of Better Health. We chose that theme because it represents scientific and medical research, immunization education, collaboration with a variety of healthcare providers throughout the state, legislative advocacy around immunizations, and community partnerships, which are vital for immunizations throughout the state of Missouri. I have the distinct privilege of introducing to you the state's very first medical director, Dr. Heidi Miller. And so Dr. Heidi Miller is the Chief Medical Officer of the Missouri Department of Health and Senior Services. She previously served as the Medical Director of St. Louis Regional Health Commission and worked as a population health strategy consultant for multiple nonprofit equity-focused health agencies, including the Missouri Primary Care Association, the Missouri Medicaid Primary Care Health Home Initiative, and St. Louis Integrated Health Network. Dr. Miller has maintained her primary care practice at a federally qualified health center in St. Louis, Family Care Health Centers. She also trained at Yale University and Harvard Medical School and completed her residency in internal medicine primary care at Harvard's Brigham and Women's Hospital. She is the recipient of Healthcare Champion Award from the MHCA and was recognized as one of St. Louis Business Journal's 40 Under 40. Dr. Miller has focused her career on promoting policies that foster integrated, team-based, equitable, and trauma-informed care for our most disenfranchised patients. Thank you so much for being with us, Dr. Miller. And here's your clicker.
I have no financial disclosures, but I have included some photographs from my patients and staff. I've been given explicit permission to do so, as well as some artwork. This is a patient of mine who does therapeutic coloring to help her cope with the issues that she's dealing with. Okay, so quick agenda. We have a really rich conference ahead, and I want to warmly welcome you and tell you how excited I am about the agenda. And to get us started, I just want to start with some gratitude. I want to acknowledge our challenges and our journey, really capitalize on our assets, and think about moving forward. So first, gratitude. You have shown up, you have followed through, you have stayed here, and you are leaning in. Some of your colleagues have retired early or transitioned to other positions, but you are here and you are proudly serving the state of Missouri for each of your populations, for your community, in order to make our state a safer place for them and for all folks. I also want to express gratitude for my new colleagues at the Department of Health and Senior Services. I started this job in January, and it has been a really exciting and steep learning curve. I wish more physicians like myself understood public health and that it was part of our education, and we can do that. We're going to work on that. I am deeply indebted to those of you and my colleagues who have been doing public health for your entire career, doing it selflessly and doing it through the pandemic. So the Vaccines for Children program is quite impressive. In 2022, the VFC program provided more than 1 million doses of vaccine, totaling over $72 million to 674 VFC providers. In addition, there were 26,000 doses of adult vaccine, totaling almost $1 million. The Show Me Vax program, which is a Missouri statewide immunization registry, which you know contains 81 million vaccine doses, represents more than 9.9 million clients, includes 10,000 service providers submitting immunization information, and allows over 1,000 schools and daycares to review records. They are also the vaccination and immunization efforts of the department and of yourselves and of the colleagues within the federally qualified health center where I still have my practice are an anchor for care. Please know that the requirements for daycare and school immunizations and the persistence and the perseverance that you have had in encouraging our patients to have those vaccines connect patients to care. There are so many valuable things that we do in primary care that the public may not understand. Those who get vaccines and come in the door for vaccines are then able to receive the services of what our pediatricians provide, including lead testing, checking for neglect, abuse, lack of meeting milestones. In preparing for the honor of talking to you today, I spoke to some of my colleagues. I'm an internist, I take care of adults, but I asked some pediatricians in my office. And one of the pediatricians just pleaded, like, please don't stop the vaccine requirements and the education toward vaccines. She says she has some families where she sees them until 1 year because of their shots, and then they disappear until they need their kindergarten shots. And then they disappear and they show up at 11 when they need their next set of shots. And all that time in between, there's no primary care, there's no preventive care. She and our colleagues and myself are very grateful for everything that you're doing. Likewise, there's a ripple effect on the family. So I've had patients who've come in, they bring their babies into our community health center to have their shots, and it's the wonderful pediatrician and family medicine doctors that realize that mom's not doing very well. We've had cases where a child came in for their vaccines. The pediatrician recognized that the mother was having postpartum depression. Fortunately, in a community health center setting, we have the privilege of immediately connecting mom to care. Under the same roof, same day, behavioral health consultant. Let's take care of mom because we all know that the baby's care depends on the family's health. As an internist, this has happened to me as well. I had a patient who was one patient on a schedule about 30 per day, totally overwhelming. But I thought this patient would be easy because all it said in the appointment line was Hep A shot. And sure enough, he just had a requirement for Hep A for his new job at a restaurant. Of course, we don't give you a Hep A shot with getting vital signs on the way in, which indicated that he had a blood pressure of 180/100. So we took care of that. In the process of just asking him a couple questions about blood pressure and just doing just some brief review of systems, in addition to giving him his hepatitis A shot, we found out that he had gonorrhea as well. This photograph is a picture of him. It was the Hep A shot that connected him to primary care. He became my patient for now 20 years. And look how good his blood pressure is. He loves to report back to me via the photos on his cell phone. So his blood pressure got down to 112/63, and he grows his own sweet potatoes. And we'll chop them up and we'll fry them up in a little bit of olive oil, but it's better than the potato chips that he was eating before that were salted. It's amazing that vaccines are an entry point. The enormity of what you're doing, please understand that on the receiving end. And in the public health sphere, even when folks come into you and they learn that they can trust you and they receive a vaccine, they are more likely to trust you again when they're concerned they have an STD or have some chronic disease or they need breast cancer screening. I know that you help with all of that. In addition, I'm grateful that you are working to thwart vaccine stigma. Why undeserving stigma for a disease spills over to the vaccine saddens me. And yet, you're doing it anyway. We're trying to get vaccines out for everything. There may be stigma associated with COVID, HPV, hepatitis, even measles, or even people deciding to get a vaccine but not telling the community in which they live. And on the HPV side, one of the best ways to reduce stigma is to explain that it is a systemic prevention. And you've got a great talk coming up from Dr. Heidi Miller, our dental chief officer for the state, talking about the role of HPV and other vaccines as well. HPV prevents oral cancer, not just genital infections. The more we can educate our public about that, the more we can thwart stigma. Thank you for what you are doing toward this goal. Okay, so let's walk through our challenges. I want to frame it in such a way that we know that the challenges of the pandemic the last couple of years is a journey. and that there is light at the end of the journey. There is more knowledge and wisdom at the end of the journey. Remember when the barrier for shots was mostly pain? My first memory of vaccines was watching my older sister being held down on an exam table by 2 assistants while the nurse injected her vaccines. It looked like torture, and it sounded like it down the hallway. Of course, my sister, a few short years later, pierced her own earrings in our family bathroom with my mother's sewing machine needle and an ice cube. So I think this might be a control issue of who's inserting the needle. And I will say that watching her be tortured in the clinic was not the moment that I decided to enter the healing and public health profession. And yet, nevertheless, 30 years later, I'm taking my sons to the doctor for their shots. And I have one son where every single time, until I think he turned 16, he's 20 now, I had to explain in detail and repeatedly the answer to his one question of whether or not the needle would be inserted through his arm on one side and would not actually puncture out through the other end. We addressed issues of pain. We were good at that. Things have been so much more challenging. As an internist, I only take care of adults, but I have deep respect for the family medicine doctors who work in my clinic. They take care of the whole spectrum of care, and I also ask them about what it has been like for them through the pandemic and in helping our patients get immunized. And I got some really nice and meaningful suggestions. My partner, Dr. Hefner, he said, we have some patients who say, look, I don't want the vaccine, I don't like needles, to which he responds, that's okay, we actually worry about people who do like needles. Here's the journey, and I promise there's a positive end to it. As I think about our journey through the pandemic and how hard you've worked, and the fact that you are still here, and for those of you who have newly joined us, welcome, you are our people. You know the stages of grief. Elizabeth Kubler-Ross described these stages of grief in 1969. They've been expanded since then and applied to a lot of different things. But what I'd like to do is march through each stage in our patient's journey with immunizations during the pandemic. Denial, anger, bargaining, depression, acceptance. Number 1, denial. Disbelief and shock. It actually provides emotional protection. There is a psychological reason why we go through this. And many of us in this room may have gone through this at the beginning of the pandemic as well. I had an 84-year-old patient from Bosnia. I came in for a routine visit for her congestive heart failure. I said, how are you doing, Mrs. So-and-so? She said, how do you think I'm doing? My heart hurts and I can't breathe, and it's all because my son has not called, he doesn't even bother to write, and he doesn't even visit me. We talked about this for quite a period of time, and I attempted to manage her medical issues despite that enormous stress. At the end of the visit, the interpreter outside of the room explained to me that her son was slaughtered in the Bosnian War. Likewise, when COVID happened, and she lost a neighbor down the hall of her elderly housing unit, she was equally in denial and likewise declined a vaccine. I also have a 44-year-old daycare worker in my practice who, she didn't deny that the pandemic was happening, but when I offered a COVID vaccine and she declined, and by the way, it's fascinating. Every patient that has declined a COVID vaccine has shared with me a different reason. There is a unique reason for every single patient who has declined it, which means that we need to really personalize and take a compassionate and trauma-informed approach to each individual who declines to put this thing in their body. This patient, her reason was, she goes, well, I really it's just, primary care is just, it's so hard. I got 15 minutes to manage 3 medical problems, but this was an important issue, and we spent 13 minutes sort of going through this. And she said, I asked her why she was hesitating, and she said, well, I heard that it's actually not even a vaccine. That's another form of denial. she actually did end up getting it after I was able, she actually believed in vaccines. She just didn't believe that this was a real vaccine. So we personalized that approach for her. Also with denial, I marvel at the irony that people will deny maybe the pandemic and maybe the value of the COVID vaccine, and yet they will affirm a theory of an implantable device. Let's just pause and marvel at the human psyche. Instead of getting frustrated and mad at it, let's just accept that humans are fascinating. They have great variability. We need to meet them where they're at. It's an enormous challenge, but it's going to take an individual approach. And the only way we'll reach that individual is if we start off with respecting that individual, even if we disagree with what they're saying. Moving on to anger, frustration, pain, and feelings of betrayal. You know what betrayal feels like for our patients? When they finally succumbed to the vaccine. And then they got COVID anyway. And we're like backtracking on our communication, and we learned the lesson from that. We understand to provide a nuanced messaging. It's also interesting to think about the role of anger in blaming vaccines for autism. People struggle with autism. It is something to be angry about. I have a child who's on the spectrum. People can be angry about that, and isn't it convenient to find something to blame? But as I queried my colleagues in preparing for today, none of their patients were talking about autism in the last few years. Isn't it incredible that someone can come up with a fictional description of why you shouldn't get this vaccine, and yet the flavor of that may change as time goes on? And yet it's our patients who are believing other sources more than they believe a medical or a public health authority. I say we have to accept that. I have to accept it that my patients will listen to their peers more than me. Good Lord, if I took that personally, I would have burnt out from primary care a long time ago. I remember I had a patient who had excruciating hip pain for 5 years and was wanting narcotics, and it was because she was completely miserable. She was in so much pain. We tried different medications. She had medication side effects. She just would not get the hip replacement that she needed and that I was recommending until she went swimming at the YMCA, and she was getting dressed, and another lady was getting undressed in the locker room, and she saw the scar on the woman's hip, and she was like, "What's that?" And a woman said, "I had a hip replacement, and it has given me a new life." So she came in, and she was ready for her hip replacement. So I can't get frustrated about that. I have to own it, acknowledge it, notice my place, squash the hierarchy. She is an expert of what she wants and who she's going to listen to. I'm an expert of one form of education, but if there are intersection points, and if at least I can maintain the continuity in the relationship with her through primary care or through trusted relationships with the public health department, she might come back when she's ready. Likewise for vaccines. Bargaining. 7 years of medical school and residency, so much curriculum, so many classes, and not one of them on negotiation. My favorite nurse practitioner in the clinic, when I was asking her about her tactics for helping patients to do vaccines, Jackie Bergeron said, she has a lot of patients say, quote, "I don't want things in my body that I don't know what they are." And then she says, "Do you eat hot dogs?" And that disarms them, and then she can begin the dialogue. So it's, let me also tell you the story of Mr. J. This patient's been mine for 20 years, though I would find that at times he would disappear. He would sometimes not show up for like 9 months. And I really worried about him because he had diabetes. And then he'd show up and he'd want his refills. And I'd say, "Where are you? Where were you?" And he was like, "In jail again." He had schizophrenia. And he was very forthcoming saying, "Well, you know, every time that I run out of my meds, I get super frustrated and anxious and people make me really mad. And then I stab someone and then I end up in jail." That had happened 3 times. Now, mind you, I pride myself in treating all my patients equally, except for Mr. J. We roll out the red carpet for Mr. J because when I keep him waiting too long, he gets super frustrated. We don't need him frustrated. Even the front desk knows when he comes, he gets roomed immediately. When he's in the room, I will be walkie-talkied out of one room to take care of him. Now, it is impossible to take care of 25 patients in one day in 15-minute increments, so I run behind. I'm an on-time person, but I painfully run behind in primary care because I can't squeeze human beings in 15 minutes, but he cuts the line all the time. Over the years, I came to really like him. He worked really, really hard on his diabetes despite dealing with an alcohol use disorder. He really struggled with his mental illness, but he really tried to take his medication regularly. I'm pretty sure that he only visited me because every time he came for his diabetic check, he was able to get his Viagra refill, and he would repeatedly interrupt me when I was trying to take care of really complex medical issues because he has many. He'd be like, "Did you send the refill in for 30 tablets? Are there 11 refills on it?" And I was just making sure that he was okay and safe with that amount. One day I asked him if he would like a COVID vaccine. And he goes, "Ooh, no." And then, okay, I'm really excited for the motivational interviewing talk tomorrow. I think that's a super powerful tool, and it takes a lot of practice. And I've learned some about it, but I need to practice. I'm going to be listening and taking notes tomorrow. But I tried to use my infantile motivational interviewing skills with him in this vaccine discussion. And I said, "Mr. J, on a scale from 1 to 10, how likely are you to get a COVID vaccine?" And he's like, "-15. And I was like, okay. So I learned back off, plant the seed, maintain the relationship. If I push any further, it's actually going to have a negative effect. And it's also going to damage my relationship with him to manage his hypertension, diabetes, etc. Doctoring is very similar to parenting teenage boys. You know when to stop and when you're going to, and you'll need to return later. But interestingly, for that visit, I bargained with him. I was like, "Well, if you don't get the COVID shot, how about we do a flu shot today?" And he's like, "Oh, okay, I'll give you that, Dr. Miller." And we got it. So there we go. Next stage, we're moving on to depression. I'll be real short on this slide. Reflection, loneliness, disappointment. Our patients felt this during the pandemic, and so did we. I had a patient who did telehealth for 2 to 3 years, and then she returned for the first in-person visit. I did as much as I could through telehealth. She even had a blood pressure monitor at home, so I was getting heart rates and blood pressures, but she came. She'd lost 30 pounds. She was just gaunt. And I just thought, oh gosh, she probably has cancer or something. And I missed it through telehealth. Because telehealth is helpful, but it's not enough. But upon more exploration, she was so isolated and lonely and not feeding herself at home that her weight loss was due to depression. And likewise, when I suggested a COVID vaccine, she declined. And she declined anything else that required extra effort or thought. All right, let's hurry up through depression and get to acceptance. Acceptance in the stages of grief is reconciling, integrating, awakening, strengthening, reconstructing, and hope. This is where we think about our vaccine victories. I only have a short time with you today, and you have a really great talk coming up from Dr. Tora Belice. So I want to make sure I finish on time, but I wanted to ask you for your vaccine victories. And if you feel like sharing it after this talk or sometime during the conference, please share. Share with your colleagues, share with me. I would love to learn from you. One of the things that we have realized is that the vaccine victory does not always occur the first visit. There are so many things that when you're proposing putting something in someone's body that will last for the rest of their life, expecting them to make a decision the same time you have the conversation may not be reasonable in some instances. Isn't it interesting the way I phrase that too, that it resembles like an implant or a microchip? Giving people space to ask their questions, but to come back. The relationships we form with our community, with our public, with our primary care patients, et cetera, is so important. I've worked in population health and health improvement efforts in so many different realms, and so many solutions come down to relationships. Okay, so I've walked through the stages of grief for our patients. We get landing at acceptance, but I do want to acknowledge your journey, our journey. We've been through this through the pandemic as well. And I honor that you've done all of that and you still show up today. All right, let's move on to our assets. This conference is great. The agenda is terrific. I'm looking forward to it. Being here, showing up, sharing ideas. This is where we further empower ourselves, embolden ourselves, where we refuel ourselves. I also just want to acknowledge staff and peer public education. This is my medical assistant. This is actually Halloween, and to be really spooky, he actually chose to dress up as me. This is my nurse, Cindy, ready to give a vaccine, and this is my patient. Can you see her earrings? Love. All of us are working hard. We're still working together. We have each other, and we have the network in our organizations. My patient on the right, she owns her own catering business in a tiny, like little hole in the wall in northern St. Louis, and she is so warm and welcoming that when hungry, homeless, unhoused folks come in, she feeds them. But she also teaches them that she gets her COVID vaccine, and she asks them if they've had a COVID vaccine. These are all our teachers. As a physician, I am nothing without my team, and I'm nothing without patients educating their family. Another asset we have is to leverage trauma-informed care. So at this point in 2023, all of you have been trained in trauma-informed care. This is a powerful tool for helping our patients and public get vaccinated. These same guiding principles will help us. So when you're super frustrated that you feel like you're not reaching a patient or you feel like you're not getting your numbers high enough, just look through this paradigm. What can we do to further leverage this tool to reach our patients? And you may say, well, okay, what does trauma have to do with vaccinations? Trauma is we use it as an umbrella term to describe acute stress, historical stress, chronic unmitigated stress. Invitation to a vaccine is not a transaction. It's not like being at the deli and saying, would you like pastrami today? It elicits an emotional response for people who don't want the vaccine. And through this pandemic, those of you who wanted the vaccine, and I can speak for myself, when someone gave me a vaccine, it was an emotional response. I said, yes, I would like it. And as I got the injection, I felt very indebted to the person who had done that for me. And I expressed that gratitude. We understand through trauma-informed care that we are a product of everything that has happened to us. And there is a reason behind every behavior. There is a reason behind every decision. So in terms of this fear, what do we respond as humans and as mammals when we feel trauma? We have a fight, flight, or freeze response. What does this look like when we're trying to help our patients in public? When there's any fear or apprehension about the vaccine, we bring to that decision all the experiences in our life, traumatic or not. And many of us fight. We fight on the internet, we fight in social media. Many of us flee, run away. I've heard and I've had patients who actually don't even follow up with primary care because they know that I'm going to ask them that same question again, and they don't want to have the dialogue again. It's very inflammatory and it's triggering. And then many of our patients freeze. They're in indecision. They kind of think what I'm saying is a good idea, but everyone in their family doesn't get the vaccine. And we've actually been told by patients, oh, our family doesn't do vaccines. So then how do we use this tool of trauma-informed care? Let's start with choice. I found that if I started this discussion in one way with most patients, it actually opened up an authentic discussion. I would say, thank you. This is a deeply personal decision, and whatever you decide after learning the facts, I will respect you. It's amazing. The patient would be on guard, and then you would just see their shoulders come down. This framing gives them a sense of choice, The long-term relationship provides trustworthiness. I'm empowering them to make a decision. And then if they decide to take the vaccine, then I empower them to educate their community, their peers, their best friends, their mom, their dad, their kids, their cousins. We also need to make sure there's equitable access. We need to make sure that our safety data is as robust as possible and that we communicate it clearly so that they then, again, will trust us. And then we collaborate. We acknowledge that the world is no longer, and maybe it never was, following this myth of doctor knows best, doctor gives orders, and patients obey as if they are robots. Collaboration is equal. There's a democratization of this team between doctor and patient. What about us? We've been through trauma as well. I honor the suffering that you've had, both professionally and personally, through the pandemic. And we need trauma-informed care applied to us. How many of our colleagues and how many of us have temporarily fought, or just frozen? The emails don't get answered, the phone calls don't get answered. We just froze. We've been through this trauma as well. This is a picture of my nurse and I. We need to apply these principles and this grace to ourselves. And as leaders in your organization and community, I encourage you to take a trauma-informed care approach to supporting your staff and really acknowledging and honoring their suffering and moving through it, moving through those stages of grief to the acceptance stage. Lastly, moving forward. So you are here for the next 2 days to refill our syringes, refuel our efforts. We are here to learn together, to be a community, to embolden each other, and you're going to learn a tremendous amount, especially from Dr. Torabalitse's talk in about 2 minutes. Thank you so much for being here, and thank you for listening. I appreciate it.